Hello, I'm Dr. Chris Steele and welcome to The Best of Health. I just want to touch upon a topic that does bother me and a lot of doctors out there, and that is diabetes. When you talk to people about diabetes, oh, that's just sugar in your blood. Yeah, it is sugar in your blood, but the consequences of having diabetes are very, very serious. So let's just look at some basic facts. There are about 2.5 million people diagnosed with diabetes in the UK now. However, because many people with diabetes do not know they've got it, it's there progressing in their body, there's an estimated 1 million people walking around out there with diabetes, the missing million, undiagnosed. Now, 90% of adults with diabetes have type 2 diabetes. Type 1 diabetes is a different type altogether, but I'm talking about type 2, the most common type of diabetes that we have out there at the moment. And the number of people who have type 2 diabetes has trebled in the last 3 decades. And by 2030, 4.5 to maybe 5 million people are expected to have developed diabetes. And the reasons within this aging population are obesity, lack of exercise, and unhealthy diets. In other words, this looks like a Western civilization disease, right? It's a lifestyle disease. And what is it? Well, diabetes is a condition where you get high levels of sugar in your blood. And those high levels of sugar damage the lining of the arteries that supply all the organs in the body. So diabetes can affect the brain, strokes, can affect your eyes, deteriorating vision and blindness. Diabetes can affect your heart attacks, etc. It can affect your kidneys, kidney failure. It can affect the artery supply in your legs, so you get bad circulation. Your legs may ache when you walk. That can be bad circulation, and diabetes affecting your circulation can lead to gangrene and limb amputation. Diabetes is a nasty condition to be diagnosed with. Now, we can do all sorts of things here, but let's look at the symptoms. How would you know you've got diabetes? Well, the symptoms can come on very, very slowly. You may not notice them. The sort of symptoms that occur in a patient who's developing diabetes or has full-blown diabetes are a thirst. You feel very thirsty at times, dry mouth, passing a lot of urine because your body's trying to get rid of the excess sugar. So it's passing it out in the urine, so you're passing more urine than normal. Tiredness is very, very common as a diabetes symptom. And also boils, recurring boils, other infections like urinary tract infection, cystitis, recurrent attacks of cystitis, thrush, in women in particular, vaginal thrush. Now, you may be getting recurrent attacks of thrush, you may be getting recurrent water infections, and they're just being treated. And yet the cause of it, behind all this, is a rising blood sugar. You've got undiagnosed diabetes, maybe. Deteriorating eyesight. Well, I can't see things as well as I used to. You go to the optician, and the optician looks at the back of your eye, and he can diagnose diabetes from the back of your eye, which I think is just wonderful. It's dramatic. Weight loss is another symptom of diabetes. Now, you could have one or two of those symptoms. You might have them all. But if those symptoms are there, you should go to your GP and get this diagnosed. Now, just by the way, you could test yourself, DIY test on diabetes. And not many people know about this. You can go to the chemist and buy dipsticks, which you dip in your urine. Now, basically, you take the dipstick, stick it in a sample of urine, and if it changes colour, there could be sugar present. Now, this one here, this is pink. This is a dipstick that's gone into normal urine, been no change in colour. This has gone into a urine that contains sugar, as this one has, and you can see they've changed colour to a dark blue, deep purple colour. So it might be worthwhile just discussing this with your GP. They're not expensive, and there we are. You know, if sugar is present on this dipstick test, then of course you go and see your GP and discuss, you know, what's going to happen there, the future management of your condition. Now, who's at risk of diabetes? Well, very simply, over 40 and overweight. Are you over 40? Are you overweight? And let's look at weight. I would rather look at waist. Is your waist over 32 if you're a woman? Is your waist over 37 if you're a man? Then your waist size is too big. So a woman should be no more than 32 inches at the waist, and a man should be no more than 37 inches at the waist, because that puts you at increased risk not only of diabetes but of all sorts of other conditions that are subsequent to being overweight: heart attack, stroke, etc., etc. Who else is at risk apart from the over 40s and the overweight people? Africans, Afro-Caribbeans and Asians are at increased risk of diabetes. And if they're over 40 and overweight, wow, they've got a high risk factor, collection of risk factors for diabetes. You may be at increased risk because it's in your family. So look at your family history. Anybody had diabetes there? And of interest also is a woman who's been pregnant and had sugar in her urine during pregnancy. It's called gestational diabetes, which clears up after the pregnancy. That woman can be at increased risk of diabetes in the future. So some interesting sort of aspects of diabetes, and I think we should all be aware of it, especially if you're overweight, over 40, and your waist size is more than 32 if you're a woman and more than 37 if you're a man. Thanks for watching. This is Dr. Chris Steele, and I'm wishing you the best of health.